Okay, so welcome back to Juniors Class 2023. Let's look at our next scenario. I'm going to share the screen. So our next scenario is a case of rape or sexual abuse. In this particular case, you're an FY2 in a GP, a 19-year-old has presented with some concerns. Your task is to talk to the patient and address the concerns. Talk to the patient and address the concerns. In this particular case, when you ask the patient, how can I help you? The opening sentence is, doctor, I need a sick note. He looks anxious and not maintaining an eye contact in the station. I need a sick note, doctor. So of course, we have to explore. Yeah, as usual, we have to explore. Yeah. So this patient is not maintaining an eye contact, was sexually abused by someone at the birthday party, and therefore is here for a sick note. Why is he here for a sick note? Okay, so he went to school and he's supposed to be having exams. He feels that he cannot manage to have exams, and he has told them that he has told somebody at school, a school social worker or school nurse, that is not able to do some of the assignment because he's not feeling well, and he has been told to go and see the doctor. This is why he has come in here to see the doctor, and he wants a sick note from the doctor. So yesterday, he went to the friend's place, birthday party. One of his friends had a birthday party, and they went to his place. And while they were at the birthday party, his friend's brother, forced on him, okay? And in other ways, he raped him, okay? While they were at the party, everybody else was outside, they were smoking, and he was left in the room or in the house alone with a friend's brother, okay, who followed him, and he forced him to remove the clothes, and forced his penis into his mouth, and also had the penetrative sexual intercourse, penetrative anal sexual intercourse, yeah? Penetrative anal sexual intercourse, okay? He tried to shout, but nobody could hear him, so he did not get any help. He's 19 years of age. He had gone to the birthday party of his friend, and it is his friend's brother that he raped him, okay? And so what did he do? He removed his clothes by force. He forced his penis into his mouth, and he had the penetrative, forceful anal sex. Okay. He himself, he did not drink on the day. Okay. He did not smoke on the day, did not use any recreational drugs, but the people there were many, and they were drinking. He's not sure whether his friend's brother was using recreational drugs or not. Okay. And as I said, he went to the school today. He wasn't feeling well, and he told them he's unwell, and he was told to see the doctor and to bring a sick note. If he's not going to be able to do the exams, he has to bring a sick note from the doctor. His friend's brother is 25 years of age, and he is a first-year medical student. Okay. Now, generally, as I said, set up on the station, the patient is anxious, not maintaining an eye contact, looks agitated. He just wants a sick note. Okay. When you ask, is there any particular reason why you need a sick note, he'll be able to tell you the story of what happened and why now he needs a sick note, because he cannot do the exams and he's in school. He has some questions for you. What will you write on the sick note? And how long will you give me the sick note for? Okay. What will you write on the sick note, and how long will you give me the sick note for? So let's look at approach to this particular task. Okay. Grips, nice and friendly. It's very important, of course, to ask about the history of the incident. Okay, so we're going to start with an open-ended question. How can I help you? Yeah, open-ended question. How can I help you? Doctor, I need a sick note. So in this particular case, we're going to follow it up with why do you need a sick note? Then he's going to tell you the story about what happened. Then you're going to follow up some questions. It's very important from the beginning to pick up the body language. You look a little bit anxious. You don't seem yourself. Is everything okay? You pick up the body language, yeah, from the beginning. And of course, you follow up when he tells you what happened. So what happened exactly, and when did it happen? And how did that happen? What did he do? Was there anybody around at the time? Okay, and what time did that happen? Who else was there? And what happened afterwards? Did you go home? Did you get an assistance? Okay. And who has he spoken to? Have you spoken to your parents or any of your friends? If not, any particular reason why he has not spoken to his parents or anyone. Okay, and would you consider to tell anybody what happened? Okay, and then it's important to ask if he did drink alcohol himself, and was a friend's brother also drunk? Were people using recreational drugs or not? Now, it's important to ask about the effects of the symptoms. How are you experiencing? Are you feeling any anxiety? Are you getting any palpitations when you, of course, you remember what happened? If yes, what symptoms are you experiencing? Any chest pain, any shortness of breath, any palpitations? We need to ask about the anxiety symptoms that somebody may experience after going through a traumatic event. Okay, good. What about sleep? You know, he has not been able to sleep properly since it happened yesterday. He wasn't able to sleep because he was very frightened, you know, very scared, you know. So how much sleep did he manage in the last 24 hours? Okay, he said he mentioned this, he told someone at school. Who did you tell at school, and what did they tell you? To go and see the doctor and get a sick note. Now, the effects of the symptoms. So show some empathy. So I know that it can be very distressing experiencing sexual abuse, okay? And you ask for a sick note. Do you feel that you're not, you know, do you feel not like going to school? Do you feel that you're coping, or you can just concentrate? How are you feeling at the moment? Okay, just to ask how he's feeling. Do you have any fears? Is there anything you're worried about? Are you worried this could happen again? How far away do your friend live from your place or from your house? Okay, have you been threatened, for example? Have you been threatened not to tell anybody? Okay, do you have any medical problems, maybe anxiety or depression? Do you take any regular medications? Social history. Who do you live with, or who else is at home with you? Do you smoke, do you drink alcohol? Relationship. Have you ever been in a relationship? And generally, do you tend to be in a relationship with males or females? This is important because if he is straight, so he tends to be in a relationship with the females, then he was raped by a man, that could be even more traumatic. Okay, good. Reporting incident. Ask about if he has thought about reporting. Have you thought of reporting this to the police? Do you know that it could be reported? Okay, do you feel that you would report this to the police, or would you report it to the police now that you know? If he says no, is there any particular reason why you wouldn't consider reporting to the police? Have you been threatened about reporting this to the police? Okay, if he was threatened, you know what threat, of course, what were the threats? Okay, so once we've finished the history, then of course with your examination, it's not just an inspection, just to have a look. Okay, have a look, inspection of the mouth, of the genital area, of the anal area. Don't do an intimate. We're not doing an intimate examination, just an inspection. An intimate examination should be done by somebody more experienced. Usually they are trained policemen that you do examination for what? For assault. Sexual assault is done by the police people. Examinations, okay, are done by the police people. So what possible findings can you find in examination? You know, genital, anal, or perianal injuries, bruises, swelling, bleeding, abrasions, anal fissures, a gapping of the anus, anal or genital bleeding or discharge, depending on, of course, on the rape. Diagnosis. Explain that what you have gone through is not acceptable. Okay, you have been actually abused. You know, I am sorry. What has happened is not acceptable. Nobody should be placed in your situation. Nobody should have to go through what has happened with you. Okay, it is not acceptable. It's not tolerated. It is unlawful. And this type of incidents, should be reported. Okay, good. So, I am sorry for what has happened. Okay, so what you can explain, what you have gone through is a very difficult situation, is very traumatic, it's stressful situation. What you may benefit, I feel you may benefit from what? Counseling sessions. Would you consider to go for counseling sessions just to cope with what has been happening? So you can offer counseling sessions. Okay, good. Now, so what else we're going to have to explain in this particular case? Okay, we're going to have to explain that of course, you advise him to report to the police. Okay, this is sexual assault or rape, what he has suffered, and it's unlawful. Okay, and then advise to discuss with the parents as well. Yeah, to discuss with the parents and explain that you can also explain to the parents if he wants to, but not without his consent, as long as he's happy. Okay, and just ask him generally, do you, wish to report this to the police? Okay, do you wish to report it to the police? What else is important? Offer him to go to gum clinic. He is worried he may get sexually transmitted infection. Explain that he can go to gum clinic for screening. Okay, and also when he goes to gum clinic, they would consider post-exposure, prophylaxis. Okay, post-exposure, prophylaxis for HIV, post-sexual exposure for HIV. That would be considered in the gum clinic, okay, because the specialists in this area, they can also do some, of course, tests to screen for STIs, okay, and explain that you're going to discuss with one of the senior doctors or colleague in the department. But patient is worried about post-exposure, it's worried about STIs. So he needs to go to the gum clinic for post-exposure prophylaxis. You're going to discuss one of the senior doctors or GPs in the practice, explain that he may wish to report the case to the police and ask him if he wishes to proceed. And and of course, also refer the patient to, of course, you need to refer the patient for assessment. Yeah, that is a sexual abuse assessment center. There's a sexual abuse assessment center where they can be examined officially. Okay, sexual abuse assessment center where they can be examined officially. Even if they don't want to press charges today, in the future they may wish to press charges. Okay, so this examination and what they find may be important for the future. Okay, so that is of course a sexual assault, okay, a center or sexual abuse center. Okay, they need to be referred there for examination, intimate examination by the specialists, usually the trained police who do that. Okay, so offer to discuss with their parents as well, and the advise to report the case to the police or to offer sexual assault referral. Yeah, sexual assault center. You go to the sexual assault center, refer them there, and they can be assessed and examined. Even if they don't want to report today, explain that this assessment may be helpful in the future should you want to report the case. Worried about HIV, you can have a post-exposure prophylaxis. Next question is, doctor, will you offer me a sick note? Yes, I'll give you a sick note. I can understand what you're going through. It is mentally very stressful. You've been through a very traumatic situation. Okay. What will you write on the sick note? What will you write on the sick note, doctor? So explain that I will not be writing specific details about what happened. I was simply going to write a sick note for you, write a letter. So this is not remember, this is not a sick note or a fit note for work. He's not going for work. This is for school. So you just write a letter to explain that he's unwell at the moment to go to school or to attend the school. He's unwell. You've got to do some of the tasks at school. He needs more attention, to attend to his health. But you're not going to be writing specific details about what happened.